Good afternoon, everyone. Today, we on the World Sight Day occasion, I'm going to talk on protecting and taking care of your eyesight. Eye is an important sensory organ, and there is a saying that the eyes are windows to the soul. We all know that eyesight is a window to the world, and our experiences of world are through our sight. 80% of our all memories are determined by what we see. World Sight Day is an annual global event which draws attention on blindness and vision impairment. The objective of this is to create awareness about eye care, vision blindness, and treatments involved in the curing of some important eye impairments. This day is focused on drawing attention to leading causes of blindness or visual impairment like cataract, glaucoma, and refractive errors, etc. Why do we have World Sight Day? Because sight is very important. Globally, 2.2 billion people have an unaddressed vision impairment or blindness. Among these, 1 billion people have vision impairment, which could have been avoided and yet needs to be addressed. As per a recent survey, approximately 2% of India population is blind due to various reasons. And approximately 1.1 million people are because of corneal blindness. More than 1 lakh corneal transplants are required annually in India, and current rate is very low, that is just 25,000. And in COVID time, it has still gone further down. So there is a need of more corneal donors. Sight is physical. It is a sensory experience in which light reflects off objects and the eye, it focuses inside the eye on the central part of the retina like here. Actually, it is an inverted image, exactly like in a camera. The signals are sent to the brain, where it is interpreted like a computer. So the sight allows a person to witness an event, but the vision helps him to understand the significance and draws interpretations. So protecting our eyes and sight is highly important for each and every individual. So this is how an eye likes. It is exactly like in camera. You can visit this site and go through the details. So this is the cornea, which is the front part. This is iris, where the pupil or the color of the iris, color of the determines on this. This is late side, it's a jelly-like substance, and the central part is retina. So exactly in the center, the vision is the sight, whatever you see, the object is focused here, and there are minute nerve fibers which take this image to the brain where it is interpreted. So it is exactly a structure like camera. The common eye problems involve refractory errors like astigmatism, myopia, and hyperopia, dry eye, digital strain in the eyes, allergic conjunctivitis, color blindness, and also night blindness. So we will see them in detail. Common eye problems could be different in children or older people. Problems in children include lazy eyes, which is scientifically called as amblyopia, strabismus, that is squinting, and ptosis of the lids. So in older people, we can have some refractory errors, especially presbyopia is very common after 40-45, which is a physiologic change because of the lens. Then cataract, the next is glaucoma. Age-related macular degeneration is also gaining prominence nowadays, and diabetic retinopathy in population where the diabetes is really uncontrolled or if it is of long duration. So myopia, also called as nearsightedness. So what happens here is the rays which are there are focused in front of the retina. So we need something for these rays to fall apart like this, travel little parallel, and then focus inside. So the eyeball length is longer than the normal eye, and hence this is problem. It is usually hereditary in nature. It runs in families. All ages can have myopia, and the symptoms can be squinting or headaches, Treatment obviously is wearing prescription lenses, that is spectacles, and the power is shown as minus power, that is something like minus 3 point diopters. Contact lenses also can be used, and refractive surgery can be done after the age of 18 years when the myopia or the lengthening of the eyeball stabilizes. The next is hyperopia, which is farsightedness. Here the length of the eyeball is little shorter than the normal, and hence the rays are projected outside a point outside the eye. So here again you need a biconvex lens to get it near focused exactly on the retina. So it can be seen at any age. There is blurred vision for near. Headaches can be there after near work, prolonged near work, and treatment again is in the form of wearing spectacles. The power is shown as positive power, contact lenses, and refractive surgery after the age of 18. Amblyopia, also commonly called as lazy eyes. So this is because one eye has a very good focusing point, whereas the other eye has some refractive power, either minus or plus, that is myopia or hyperopia, and the image is not getting focused on the retina. So the eye literally ignores this image, and the better eye starts seeing the image, even the brain starts ignoring these images because it cannot fuse both the images. So what happens is, this is the eye itself is totally normal. There is no disease of the eye, but just because there is a difference in the refractive error, this happens. There are no obvious symptoms, but it is typically detected when one eye is covered because of some reasons, or sometimes when there is a health program in schools, or when the patient goes to a doctor and he covers one eye, then it gets noticed that the one eye is normal and the other eye is not seen. So the treatment again in the form of prescription spectacles, patching of the good eye so the other eye which is not working can be helpful and can develop process of focusing. Amblyopia is diagnosed at the age of 2 years and should be treated as early as possible with patching and other things, because if you don't treat this amblyopia after the age of 7 or 8 years, the vision remains very, very low and it cannot be cured afterwards. Astigmatism is the cornea is different. The corneal curvature is different in one axis and another in another axis. So it is not perfectly round. The curvature is different, and this causes what is called as astigmatism, or commonly known as axis. So it can be present in young children. It can definitely doesn't remain constant, changes during puberty, and even afterwards. So you need to check the eye power every year if the patient has all these refractive errors like hyperopia, myopia, and even astigmatism. The common symptoms are headache, eye strain, squinting, distorted or blurred vision at all distances, because one axis gets focused and the other may not be well focused, and definitely there is difficulty of driving at night. Treatment again is in the form of wearing spectacles, contact lenses, or refractive surgery. Nowadays, we can correct the refractive astigmatism up to the diopters of 6. So up to 6, we can correct this with refractive laser surgery. Strabismus, also called commonly as squint. This is more commonly known as cross eyes and commonly seen in children. This condition is a misalignment of the eyes, especially the muscles. One muscle is weak, or one or two muscles can be weak. So one eye looks straight ahead and the other eye looks upward, downward, left or right, depending upon which muscle it has weakness. As we know that the eye has 6 muscles, and if they don't function in perfect coordination, there can be many symptoms like fatigueness, dysfunction, trauma or around the eyes can be a main cause of this if the muscle becomes weak, and sometimes genetics also can play a role. The symptoms are mainly blurry vision. Obviously, the parents notice the squinting and they get the child to the ophthalmologist. There can be headaches, excessive squinting can be there in some cases. There is a development of the lazy eye because the image is not formed exactly in the center of the eye, which is the highly sensitive point for vision. So treatment options are again glasses, eye exercises, and surgery is often more common treatment and a permanent solution. Ptosis is the drooping of the eyelid. So this is a medical term for this drooping, and it can affect one or other eye. It may cover the eye slightly or entirely, and if it blocks the pupil, then the patient can again develop what is called as amblyopia, because the image is not formed correctly. So this obstructs the natural development of the child's visual capacity, and what we say amblyopia can develop. This condition is usually doesn't become better on its own, and you need to correct it surgically. The most important thing is that the pupil should not be covered, and surgery, if it is there, has to be followed up very carefully, because cosmetically also it is very important for the child to have two eyes which look equally well. So whenever there is ptosis, you need to contact the doctor, and if the surgery is advised, should be done immediately. So next is corneal ulcer. This is a vision threatening condition. It is often caused by infections or an infection after corneal injury. The symptoms are redness, something white like this on the cornea, foreign body sensation. There can be discharge or thick pus. This is inside the eye, the pus is formed, and there can be eyelid swollen, pain. So causes can be bacterial, viral, or fungal or parasitic infections. Treatment is in the form of either amniotic, either antibiotic, antiviral, or antifungal eye drops. And we have to see these patients very often, because the cornea may rupture and perforate. And if it is threatening the corneal thickness and on the point of perforation, surgery is required, where we remove this eye and a donor graft is used in this place. So it is a very serious condition which needs urgent attention. Next is conjunctivitis, commonly known as pink eye. This is an inflammation or infection of the transparent membrane which covers the white part. And you can see the small blood vessels which are engorged, so the eye looks red. Sometimes even they can rupture and have a bleeding outside the eye. This doesn't involve inside structures of the eye. And this is more commonly in bacterial and viral infection, or sometimes and very allergic condition also. So though irritating, it rarely affects vision, because usually it is outside the eye, and treatments can help or to ease the discomfort. It can be contagious, so early diagnosis and treatment helps in limiting its spread. The symptoms, as we have seen, it can be redness in one or both eyes, itchiness, a gritty feeling or foreign body sensation, discharge, and excessive tearing. Causes, as we know, that can be viral, bacterial, or due to allergy. There can be a foreign body object sometimes in the eye, which can give rise to irritation and similar symptoms. Prevention is practice good hygiene. Do not touch your eyes. Wash hands often. Don't share towels. Personal eye care is very important so as to stop the spread of the disease. Treatment is mainly symptomatic, because it is mainly a viral condition. But sometimes if it is too severe, antibiotic eye drops can be used, and some lubricating drops can be used. And if the patient is wearing contact lenses, we always try to tell them that avoid contact lenses for a few days, even after the conjunctivitis is cured. So coming to cataract, which is also known as motibindu or motiabin, this is the most common cause of treatable blindness. As you can see, the lens which is clear becomes opaque, it becomes white. We don't wait till it becomes white in modern days of surgery, but this is why it is called as motiabin, because it looks like a pearl. So this is a clouding, total white cataract is seen like this, and it develops slowly. It is not a one-day condition, so the patients will have blurred, clouded, or dim vision. Sometimes they can have halos around the lights also. They have problems seeing at night through light and glare. So they also experience faded view of colors, and sometimes frequent change of glass prescription or contact lens is experienced. So main causes aging. The other is obesity, hypertension, eye injury. Sometimes if there is a trauma, even a blunt trauma can cause development of cataract, and any intraocular surgery. If there is prolonged use of corticosteroids in the form of eye drops, or some medications patients use for asthma or arthritis or skin allergy, also can give rise to these cataracts. High exposure to UV light, from the sun, or the furnace users, furnace blowers, they also can develop cataract. Poor nutrition and smoking also can lead to an increased risk of cataract formation. So when to consider cataract surgery? If the vision is blurred like this, clouded or dim, there is difficulty in day-to-day activities, driving difficulties there, And if you are changing frequently glasses or contact lenses, then definitely there is a need for change or need for cataract surgery. So what we do is we remove the cataract with a small probe like this, which goes through a incision which heals or which closes on its own. Remove the whole of the cataract from here. We keep the bag inside and then insert a foldable intraocular lens inside. The surgery is not painful because you can give anesthesia in the form the patient prefers. So we remove the again we remove the clouded lens and replace it with a clear artificial lens. This is called as intraocular lens. It is positioned in the same place exactly as a natural lens and remains there as a permanent part inside the eye. Very rarely, if it is not possible to use the artificial lens, then after the cataract is removed, you can use eyeglasses, which are thick glasses like our grandparents used to use, or they can use contact lenses also. It is generally done as an OPD basis, but the surgery is very skillful and you need a lot of instrumentation for this. And but you need not stay in the hospital because the patient is in a really good condition to go and travel around. So local anesthetic or topical anesthetic can be used to numb the eye, and it is generally safe. After the procedure, you have to follow all the instructions because it is an intraocular surgery and we don't want any infection to occur inside the eye, which is really vision threatening condition. So the healing generally occurs within 4 to 6 weeks, and depending upon the lens used, you may have to use near vision glasses after this. So the next is glaucoma, also called as kalamotia or kasbindu. In this, there is a damage to the optic nerve because as the optic nerve is damaged, it is impossible for the eye to take the images to the center where it is interpreted, and hence even if the other eye is normal, it is difficult for the patient to see. And what happens is the vision which is there, this is a normal vision, slowly gets constricted. So this is an advanced stage here, the last slide, and this vision can suddenly drop. So it is very, very important to get you checked because this is a preventive condition. So as soon as the pressures, we check the pressure and do certain tests for the glaucoma, like checking the optic nerve, doing perimetry and other things. So if we diagnose glaucoma, usually eye drops are prescribed, and the eye drops have to be used on daily basis, and you need to check pressure very often, like every 2 or 3 months, and do the test as prescribed by the doctor. The most important thing is diabetes, heart diseases, and high blood pressure patients carry a high risk. It also runs in families. So if you have a family history of glaucoma, you have to check your eyes at the age of 35 or 40. As in cataract, even the corticosteroid medications, especially eye drops, or the oral steroids, or steroids in the form of inhaler, can also cause glaucoma in almost 30% of patients. So all these patients who are using steroids need to be very careful for their pressure, and they get to check. The pressure needs to be checked very often. So diagnosis consists of measurement of eye pressure, gonioscopy, that is to see the drainage or angle of the eye. You need to examine the optic nerve for damage. Perimetry is needed. CCT, that is thickness of the cornea, and OCT is also needed. Basically, there is an imbalance between the production of the fluid inside the eye and drainage outside. So if there is any imbalance, the pressure in the eye builds up and slowly it starts affecting the optic nerve. So the treatment is in the form of lowering the eye pressure, either the production or either the production. Usually it works in 90% of patients, but if it doesn't work, you have laser treatment and surgery, or combination of all this can be done to have the pressure in a normal range, which is less than 20. So treatment, as we have seen, is in the form of drops. Laser therapy is also, laser trabeculosplasty can be done. This is an option where small laser beam is used to open the clogged channels of the trabecular meshwork. Filtering surgery is a surgical procedure, also called as trabeculectomy, Here we create an opening in the white part of the eye from where the aqueous can drain outside within the tissues of the eye and the pressure remains normal. You can use what is called as drainage tubes. So they have a small tube shunt which is inserted in the eye to drain away the excess fluid, and because some of these have walls, so the drainage would be normalized. So there is another option, that is minimally invasive glaucoma surgery. They are yet to come in India, but they are found to be very useful abroad. So the next is age-related macular degeneration, also called as ARMD. So it is a medical condition. There is a loss of central vision. As you can see, this is a totally normal retina. And here you can see certain white spots. So these are the disruptions or the irregularities in the outside, that is retinal pigment epithelium, which is just behind the retina. And if there is a development of a vascular tissue inside, then there can be bleeding, which can be a devastating, because this causes sudden loss of central vision. Sometimes there can be no bleeding, but there can be just collection of the fluid. So this also can cause some loss of vision and needs to be treated very urgently, because at what level you treat this is very important. If it is totally advanced stage, even if you treat it, the vision may not be regained. So this is typically seen in older people, and it is difficult to recognize because this happens centrally. So peripheral vision would be okay, but the central vision for reading, driving, or perform routine activities can be hampered. So the risk factors are heredity, smoking, and obesity. So this is called as dry RMD, and this is wet AMD. So diagnosis is, so certain tests are required in the form of what we call as OCT or optical coherence tomography. So this scans the retina, and if the irregularity is there or if any fluid is there, it can be diagnosed, and the successive scans after treatment can be seen if it is reducing or not. So successive scans of OCT before injection and after injection are also important. Another is fluorescent angiography, where a dye is injected into a vein that is of the hand, not of the eye, and then the photos are taken certain intervals apart. The dye reaches the eye within 7 to 10 seconds, and immediately we start taking photographs. So we know from where the leakage is there. So these are the new tissue which is found in the certain layers, and they can bleed or they can cause separation of the fluid from the aqueous, which hampers the central vision of the retina. So treatment again is in the form of anti-VEGF, and in some patients, if the lesion is away from the macula, laser treatment can be done. So coming to diabetic retinopathy. So diabetes affects small blood vessels of the retina. So when the small blood vessels are affected, they are not able to carry the oxygen to the eye, and there it can be damage to the retinal tissues. So they can get ruptured, they can cause bleeding. In certain cases, even though there can be severe bleeding of the eye, and this bleeding, if the cells in that contract, there can be even the retinal detachment. So distal symptoms can vary from disturbed vision to even blindness. So the condition can develop in anyone who has type 1 or type 2 diabetes, and most important is the uncontrolled blood sugar and the duration of the diabetes are the more main risk factors to develop diabetic retinopathy. The main symptoms are spots or dark string-like things, as you see here. Blurred vision can be there if the central part gets affected. There can be fluctuating vision, impaired color vision, and some dark and empty areas, as in the photograph. So risk factors, as we already said, it is duration of the diabetes and poor control of the blood sugar level. Also, concomitant factors are high blood pressure, high cholesterol, and if the patient is having using tobacco in any form. So treatment is geared towards slowing or stopping the progression of this diabetic retinopathy. And here the most important thing is controlling your blood sugar, and along with that we can give some injections to reduce the edema if it is there, and also laser can be done. Also, if there is too much of bleeding and there is a detachment of the retina, surgery also can be tried. So nowadays we know that there is an increased usage of digital devices in COVID-19 situation. And because of this situation, the watching television has gone up by 6%, news on TV is gone up Video apps, Netflix, Amazon are also very high. Now it is reached almost like 20%. Chatting on certain medias, WhatsApp and other things have gone up. So smartphone use, most importantly, and even in school children, has gone up to a very high extent. Almost all school children were using smartphone for their online teaching programs. So eye strain is a term which describes a group of symptoms which occur in some people due to lifestyle or working. But now we see this eye strain even in children because of the online teaching programs. So it is definitely uncomfortable, but it may not lead to any permanent eye damage. So mainly this is because of the extended use or computers or any other digital devices. And if there is inadequate or excessive lighting, again, it can cause eye strain. So, but the most important thing is it is not serious. And once testing and certain drops are used, it can go away. So can be reduced by simple measures. And this is not a sign of underlying eye disease, but needs treatment. So the symptoms can be blurred vision, double vision, eye irritation, stinging or burning sensation, watery eyes. If it is too much, it can be redness, intense headache, feeling or disorientation also, and sometimes difficulty in focusing after very high usage of digital media. So it can impact our quality of vision because reading can be hampered. Shopping for groceries also can be difficult. Cleaning and dusting and other working on laptop and other devices. Basically, any work which is related to eye can become very difficult because of the eye strain. So to prevent eye strain, what you can do is practice reading approximately at a distance of 25 inches, lower the brightness of the screen, follow 20-20 rule, that is after every 20 minutes, look 20 feet away for 20 seconds. You can also close your eyes for 2 minutes. Wash your eyes regularly, not the inside eye, but the outside eye, and use nighttime settings to minimize blue light exposure. Also, you can consider turning off some of the overhead lights when you are working on desktop. And try to blink, try to close your eyes often when you are looking at the monitor. So also there is a need for regular eye checkups to avoid all these diseases. So eye exam involves a series of tests to evaluate your vision and check for the eye diseases. So what are the tests what we do? So the most important is visual acuity test, refraction, that is glass power assessment. If the visual acuity is not 100%, then if there are any symptoms like glaucoma or any other symptoms, neurological problems, we advise visual field test. Slit lamp examination is a routine test. Retinal examination should be done for each and every patient at least once in a year. Screening for glaucoma in the form of applanation, gonioscopy, that is checking of pressure, gonioscopy, checking of the angle, checking for the any optic nerve problem, and if required, advising them other tests like OCT needs to be done. So children between 3 to 5 years should be undergo a comprehensive exam. If there are no symptoms or family history of eye diseases, once in a year or once in a 2 year is also okay. For adults, every 5 to 10 years in 20s and 30s, every 2 to 4 years from 40 to 54, every 1 to 3 years from 55 to 60, 64, and every 1 to 2 years after the age of 65. This is when everything is normal. But if you have risk factors, if the glaucoma runs in families, if you have diabetes, hypertension, or any other systemic problems, you need to check your eyes once in 6 months or as the doctor advises. If the doctor says you that you have to come after 2 months, you need to go because sometimes it is necessary to repeat certain tests like pressure, retinal examination, or gonioscopy also. So you need to follow the whatever advice the ophthalmologist or your doctor is going to give. So today we pledge for eye donation. So, and you have to help visually impaired to see the beauty of the eyes by donating your eyes. And it is very, very important if you are taken pledge or if you are written any form for eye donation to convey this to your near relatives because they are the ones who would be taking care of your whatever you have pledged. Thank you for your Kind attention.